So one thing is this diagnostic toolkit for bipolar disorder that I sort of mentioned. I think that's a really important project in the lab. I think that I love this ability that we can constantly push our tools into new areas, because it means that we always get the first look. And I think that it's also been a very, very powerful. So, you know, I have people who come to my lab, and what they want to train in is on using these imaging tools. And then they go get jobs, and basically they say, oh, I did this on a knockout for a certain gene, but I could do this on any Alzheimer's model. You know, they get the job, right? Because it's such a powerful tool, and you get to use it in a disease model. So I think I think it's a powerful tool because it's a discovery tool, and it gives us insight into how things work normally, but it's also a very powerful tool to probe dysfunction. Well, you know, the cancer field has really been revolutionized by this ability to do kind of personalized genetics, where you could actually take a sample of the tumor, find out exactly what the mutation is, and predict whether a certain treatment will work or not. And that has been really very kind of heavily commercialized at this point. But nobody's really done that for neuropsychiatric disorders. And if you compare the number of people that are affected, the numbers are huge, right? So for example, the prevalence of bipolar disorder, which is actually the most genetically penetrant of all neuropsychiatric disorders, it's 1% to 2% of the population. But when people have cancer, not all cancers are the same. So each specific cancer has a different diagnostic, right? So that's a much smaller fraction in comparison to the fraction of the population that has bipolar disorder. And if you ask a clinician, well, if I gave you a test for bipolar disorder, who would you test? And he said, first of all, any adolescent that's beginning to show behavioral symptoms, obviously you would test. If there's anybody in the family that has a history, I would test the entire family, including all the kids. I would test anyone who comes into my office that has depression, because it could be that it's just the first symptom of bipolar disorder. So in terms of the fraction of the population where a test like this could be useful, it's just orders of magnitude higher than any diagnostic test that exists today. And those only exist actually. It's not true. The cancer field is an area where that's been very successfully implemented. There are some diagnostic related to transplantation, to ability to accept transplants and which ones, but that's kind of it. So I think that the potential is really huge. And you know, also if you know anyone who has bipolar disorder, you can see how debilitating it is, and you know, and many of these people are brilliant, right? And this totally derails their life, and it derails the life of their entire family, right? It's a huge kind of unmet need to be able to even diagnose it. And the diagnosis is really the first step towards appropriate treatment.